Well, if you or someone you know is suffering from joint pain in your knees, your elbows, your shoulders, your back, your hip, it doesn't matter, any joint for that matter, it could be associated with osteoarthritis. And there are now treatments available eliminating the need for major surgery. Here to tell us about these breakthrough regenerative therapies is Dr. Harolyn Gills. She is the medical director at the Southwest Regenerative Institute, and I'm so happy that you're here.
Thank you. I'm glad to be here.
Okay, tell us about the Institute.
Well, we do a variety of cutting-edge procedures that involve your own body products, your own blood cells like platelets, growth factors, stem cells, to literally regenerate cartilage, regenerate tissue that has been damaged or deteriorated by age or injured.
Okay, and let's take a look at a picture we have. It can kind of give you an idea of, there is a progression of degeneration here. And we're looking at a knee, but this could be any joint, right?
Absolutely. There's cartilage in the joint that basically cushions and provides stability. It keeps bone from being on bone, and it is protective. Now, that cartilage sequentially over time begins to deteriorate. And as you can see, the white part of that diagram is cartilage, and it gets thinner and thinner until stage 4, where there's the redness there, that it depicts the bone on bone, and that is extremely painful.
And with that comes inflammation.
Inflammation is the cause of most of it. There are proteins in the body that literally cause inflammation, and these enzymes and proteins have to be dealt with. What we do is we use a product in the blood called A2M, alpha-2 macroglobulin.
That's in our own blood?
It's in our bodies naturally.
Okay.
However, it's not there in enough concentration to do the job. We then concentrate it to 6 times what's naturally in the blood, and we inject it directly into the joint where it belongs, where it can bind up those nasty enzymes and eliminate them through the usual processes.
Enzymes meaning that painful inflammation as well. Is there anybody who is not a good candidate for this? And I'm going to call it an injection because that's what it is.
That's all it is. It's non-invasive essentially. It's an injection. If there's anyone that we suspect is not a good candidate, say they're bone on bone already and they have no cartilage to restore or regenerate, we can do a test, a simple test called the FACT test, to determine whether they indeed would benefit from the procedure.
Really? Okay.
Yes.
So, but here's the point. A lot of people, this is stage 4 or 5. Now we're contemplating surgery now.
Exactly.
So many people, can't have surgery, want to avoid surgery. Will this treatment or procedure help us avoid surgery altogether?
Indeed. You know, surgery isn't a permanent fix. Many times the surgeon will tell you, this will have to be repeated likely in 5 to 10 years. What we do actually helps restore, and it halts the progression. So it doesn't keep going, and it can restore some cartilage due to the growth factors and the stem cells that are found in the body.
So it can actually rebuild itself?
Yes, exactly. It regenerates.
Regenerates.
Hence regenerative medicine. Exactly.
Okay, I get it now.
We also help with muscles and tissues and nerves, not just joints.
So it encompasses that whole area around the joint that is causing the issue. I want to talk about your upcoming seminar real quick, and because this procedure is not covered by insurance. So this is why you need to find out if you're a good candidate for this.
Exactly. And when we say not covered by insurance, remind yourself that there are costs attendant to insurance. There is the cost of the surgery, there's the pain, there's the downtime, there's the risk. We can avoid that, and it may be worth it for you to consider this is going to be less expensive in the long run. To do this one shot, maybe needing repeating, maybe not.
Okay, and this is how you find out. You just saw the information on your screen, which by the way will be on the website, but it is on the 12th at noon in Surprise, and this is how you find out. You do have to RSVP though. It's 623-337 4421 and reserve a seat and find out when you go in. And this is, I've tried to ask as many questions as I can in the short period of time we have, but for so many people, this is the best alternative.
This gives hope to people who've been told that they just have to live with it, or that they have to take dangerous medications. Many times the side effects are worse than the disease, and that they have to have surgery, which of course is intended with many risks.
And I'm sorry, living with it is unacceptable.
And it's unnecessary.
And unnecessary on top of it. All right, let me tell you also about a special offering. This is for the first 30 callers who call in. You will get to attend the Regenerative Therapy seminar for free. Your seat will be reserved for you. It's the Southwest Regenerative Institute. They're located at 15331 West Bell Road. That's Suite 118 in Surprise. Once again, that number 623-337-4421. You can also visit their website. It's swestri.com.